When somebody gets diagnosed with a condition like heart disease or emphysema or maybe a cancer diagnosis, everything changes. Their world maybe shuts down for a moment. And when palliative care comes in, we try to open up, we try to have a dialogue with really how they're feeling, how they're dealing with it, what's their understanding of what's happening. And we let them know that we're there to provide an extra layer of support.
I say to patients and families all the time is an illness just doesn't happen to the patient. It happens to everyone that loves that person.
And I think that in order to do the work in palliative care, all the members of the team have to have have compassion.
I wasn't familiar with palliative care, and I wasn't sure exactly what to expect. But what I found was that it was a group of professionals who would come in and add an extra set of experienced and professional eyes that we did not have.
To me, palliative care is a team approach to provide information, symptom management, support for patients and families to help them through the journey.
Palliative care is just another layer of support for patients and families. It's a way of letting them take control of their health care, their situation. It's a way of empowering them. That's the way I see palliative care.
For us, having palliative care involve a team of people with different perspectives just added so much to our understanding of what was going on at the time. As well-meaning as people are in any healthcare setting, sometimes you need somebody to step up and be an advocate.
And the Nells are an exceptional family, particularly Terrell and Kathy. They are sweet, caring, compassionate, very attentive to their parents, and it's very refreshing to see that level of involvement that they have.
I think once my mother was here, we were searching, and we did not have the ability to really have the conversation or to know where to begin the conversation. And that's where palliative care came in and said, okay, we can help.
I think when illness happens, people feel all of a sudden a reminder that not only are they mortal, it's a loss of control, and somehow people need to have some sense of what do I choose to have happen as best as I can control it. And palliative care wants to help people have that sense of choice.
In the case of Louise, her condition declined to the point that she had lost significant weight. Her dementia was worsening, and we felt that she would have greater support, as would her family, with that of hospice. And fortunately for her, she rebounded, she gained weight, she cognitively improved to some extent, and she no longer met the criteria for hospice. And so it's almost like handing a baton on a relay team. The baton was handed back to us in palliative care, and so we continue to have conversation with the family.
It's very vulnerable when people are facing their own death or facing a serious illness. And a lot of people have questions like, what's going to happen to me? What's going to happen to my family member? What's the next step down the road for me? What's treatment going to be like? So palliative care focuses on improving a person's quality of life.
I think that palliative care is often more than just the transition into hospice. It is really about helping a person manage a disease, helping persons at any age or any stage of an illness.
Not every patient in palliative care is going to need hospice. It's very important to understand that. But that it is a good lead-in many patients to the role of hospice.
I talked to my friend about it. I said, you know, Howard, I'm going to ask her if she would marry me. And he looked at me like that, said, you are? I said, yes.
I remember he called me that girl.
Yeah. And he said, now, what was her name again? I said, Beth. I made a lot of decisions along the way that didn't work out, and a lot of mistakes, but that's one mistake I can not a mistake, but that's one thing I can really brag about, that I made the right decision, and here we are.
When I got the referral for Beth and for her caregiver and spouse, Bud, the nurse practitioner had said they were a delightful couple, having to face this illness that unexpectedly, to a certain extent, had gotten a lot worse quickly. So when I met them, Beth was very clear. She, I think, knew intuitively that her death was going to come sooner. And she really wanted Bud to talk to me because she said he needs support.
Joe Clary has helped me to see now it has turned around, and now I'm facing a different journey now.
The role of a chaplain is to be able to engage with a person wherever they are in order that that person feels the ability to make meaning and or to find comfort and to find some sense of purpose.
She was in her room, in her bed, sleeping, and I went in there and just sat in a chair. Just looked at her, and it's just hard to believe. Mm-hmm. I guess I'm going through that stage now. Yeah. All of this is just hard to believe.
It is hard to believe.
Yeah.
By inviting palliative care in, you're inviting in a group of people who are darn good listeners. And from that listening, they say, let's talk about that.
Being across from people that are passionate about what they do, it is energizing, for one. It just validates the work that you're doing.
One of the things that I find to be very supportive and helpful is having our weekly meetings in which we talk about our new patients, our patients that have transitioned to hospice, our patients that have died on palliative care. So being able to have a team that we are able to discuss all aspects of the care of the patient is great. When I met with the family, we talked about some of the things that they were going to miss about Louise, and one of the things that they did on a weekly basis was they brought wine. I think that she might have drank this much, but it was the whole process of what they did to bring a treat to her and have a special time with her, and that's something that I think that they're really going to miss when she's gone.
The team consists of clinicians, nurses, social workers, and chaplains. And as a team, we can look at what are the needs of that patient and family, and how can we best help them and meet those needs.
When patients are first diagnosed with a metastatic cancer or a devastating diagnosis, they oftentimes don't understand what the goals of care are, whether they're potentially curative or whether we're trying to control symptoms of the disease and what to expect going forward. And palliative care has unique expertise in how to negotiate that for the patient and their family.
Often patients have 4 or 5 different doctors. They go into the hospital and they're hearing so much different information from so many people. And what we try to do is we just try to put things on pause a minute.
Palliative care needs to be promoted for what it is, and that's, yes, it's providing comfort care. It's a resource. It's a team. It's the approach. It's the relationship building. It's guiding the family, the patient through the journey.
And many times in medicine, we focus on what we can fix, whereas in palliative care, we have the ability to talk about what we can't fix. And how then do we adapt to the changes, and what can we do to make this go as well as it can go.
It's not just one person, but all of us working together in trying to give to Beth and myself what we needed during this time, during this journey.
It's good that to the extent possible you can rely on a team of healthcare professionals to manage care on a day-to-day basis, and that frees us up to be the children and the friends and the advocates for the people we care about.
Providing some level of support and empathy for people as they go through those changes, I think is very helpful. It's even helpful to me because one of these days I'm going to be sitting in their seat and I'm going to be having this conversation about my parent. When I see her when I'm in here and I see her going down the hall, she smiles, she engages when you speak to her.
That's what we want for her. Having Shari come and visit weekly is important to us because she is an independent set of eyes. If there are changes, if there are significant changes that might be hard to spot on a daily basis, she'll pick it up.
And I can think of one particular case where we were 150 miles away, and my cell phone rings, and I see the caller ID, and I think, oh no, what's happened? And it was Shari saying, just want you to know, I've been here, and here's what I'm seeing, and everything's good. And so I really value that.
I appreciate the emotion that goes with the love of a family member and not wanting to see it end, but we know that it has to at some point.
If I have a family member that has been diagnosed with chronic disease or is in a critical situation, I want to know that I can pick up the phone and I can call a team that has answers that I would need to know answers for, and also to provide that information for my loved one.
I think palliative care is for me because I am a more relational kind of person. I don't want to just look at the vital signs and the medications and decide what can change to make something better. I want to look at the big picture of the spiritual, emotional, all the components that go into who we are.
No one knows what's going to come next. And it helps to know that whatever it is, we'll have a set of people to talk it over with who have known Louise and understand where she has been.
And as soon as we step back and say, here's what's going to happen next, we've learned more than likely you're wrong. And so when that happens, that's even more important to have that backup team called palliative care.
It all has worked out beautifully. We've had our times together, and good and bad, but we did a lot of talking. We did a lot of praying.
Laughing.
Huh?
Laughing.
Laughing, yes. So here we are.
So this is the time we honor those patients who have died, and one of the first ones we're going to do is Beth Howe. Many of you may remember her. She's been a palliative care patient for a long time, and for those of you who knew her, she had a wonderful sense of humor and a lot of faith and strength as she was in the dying process. And we will take a moment of silence and remember Beth.
For those who are left behind, sometimes it's a question of, what does life look like now? How am I going to survive without my spouse who I've been with for 40 or 50 years? And so we get our bereavement team and bereavement services there. We talk about grief and loss.
The way you have helped, you've been terrific. I mean that. And I appreciate it so much. The thought came to me, well, now, what am I going to do after she goes? And I want to continue, and Beth wants me to continue to live and be myself and to do whatever I need to do. And she has helped me to see that.